Hi, everyone. I'm Dr. Lisa Palmer, coming to you live from Central Florida on fun female topics on periods, vaginas, hot flashes, and fertility with half of a dog butt in my shot. And so, if you want to see the whole dog, here's the whole dog. There he is, stretching out, keeping me company during the live. So, if you see a wagging tail, that is why. And so we work at Palmer Natural Health. We work on lots and lots of mommies. We work on lots and lots of women. And a lot of these women have symptoms. Some of these women are taught that the symptoms are for various wrong reasons, right? So the wrong reasons could be, and maybe you've heard this, so you can let me know if you've heard this. The wrong reasons are you're getting older. It's because you've had kids. It's because you're going through changes. It's because that's just how it is. It's because you're stressed. It's because you're crazy. It's because it's all in your head. So you guys can let me know, have you heard these excuses? If you're a female or you're married to a female, you might have heard these, right? You might have heard these excuses coming from maybe other physicians or nurses or your friends. I have so many female patients tell me, well, Dr. Palmer, it's just because I'm in my 40s. Or Dr. Palmer, it's just because I'm in my 50s. Or Dr. Palmer, it's just because I had a baby. Or Dr. Palmer, it's just because whatever, fill in the blank, right? And that is not true. Okay. A symptom means that something is wrong. A symptom means that something is imbalanced. There's always a cause to a symptom, always a cause. And so when it comes to periods, a period is a natural thing. Another word for a period is a menstrual cycle. A menstrual cycle is something that's supposed to happen to a female between the ages of 10 to 13-ish. We're seeing young girls, younger and younger, get their periods. My youngest patient I've ever heard of having a period was 8 years old. 8 years old having a period. Can you believe that? And the reason why that's occurring is that we're consuming more hormones in our food. We're consuming more hormones in our meats, right? So this 8-year-old started growing hair and having periods, which should not be happening, right? So all that a period is shedding of the uterine wall when there's no baby implanted, right? When there's no embryo growing, when there's no reproduction occurring. And so menstrual cycles or menses are supposed to happen. And then maybe in your later 40s or your 50s, some people in their 60s, they'll go through menopause. And menopause just means the pausing of menses. Menopause does not mean hot flashes. It does not mean night sweats. It does not mean dryness. It does not mean wrinkliness. It doesn't mean anything. It just means your menstruation, your menstrual cycle stops. It pauses. That's it. Okay. If you have hot flashes, no libido, low libido, dryness, hot flashes, sweating, if you have any of those other things, it means there is an imbalance in your system. All that should occur is period stops. That's it. The medical treatment for menopause is to give you hormones, okay? Hormones are chemicals. You make your own hormones. And in fact, you make your own hormones, your liver breaks up those hormones that are old and you excrete them, you get rid of them. If your liver is toxic, you're going to have hormonal imbalances. If your thyroid is not functioning properly because it has chemicals, metals, or bugs, or other things, you're going to have hormonal symptoms. If your adrenal glands are tapped because our society is freaking out of control, you're going to have menopausal symptoms. Or you're going to have if you're still menstruating, you're going to have female symptoms, right? You might have bloating. You might have period cramps. You might get emotional. Those are all signs that there's imbalances in the body. How do you fix them? Well, at Palmer Natural Health, we do what's called quantum nutrition testing. And quantum nutrition testing is a way of evaluating the body for the cause of the problem. Maybe you're exposed to a chemical like chlorine, which would imbalance the thyroid, or fluoride, which would also imbalance the thyroid, or too much radiation. Some of my flight attendant patients are exposed to high levels of radiation. Why? Because they fly in a metal, I want to say box, but they fly in the metal plane. Inside the plane, what are people doing? They're watching movies, they're on their phones, they're streaming. So you have more Wi-Fi signals bouncing around the plane. The GPS system and equipment of the plane bounces more signals. And then you're in the sky with a high proximity to the sun, and you get more radiation exposure. And that's why you'll notice that a lot of flight attendants have gray in their hair, or have gray hair, or they are dyeing their hair, right? So radiation is really, really hard on the thyroid. Well, you don't just have to be a flight attendant to get radiation. You could be on a computer all day. You could be on a cell phone throughout the day. You could be on an iPad or a tablet throughout the day. You could have wireless devices on you throughout the day, and that you could have a smart meter on the opposite side of this wall, and that could also irritate the thyroid gland, irritate the systems in the body, imbalance hormones, leading to symptoms of PMS and symptoms of menopause, right? And then we have the fertility cases. So I was talking to an applicant. So we have some awesome new employees. We're still short staff. So if you want to work with us and you live in Florida, you let me know. Had a great interview this week. And the lady that I interviewed worked in a fertility clinic in Washington State. And she was educating me on what they were doing. And so it's very interesting because although I'm familiar with fertility, I'm definitely not an expert in what medical fertility clinics do. I assumed wrongly that the fertility clinic was only working on female patients. That fertility clinic was working on female and male patients. So if a female is having problems with fertility, it could be a chemical toxicity. It could be a metal toxicity. It could be imbalance of bugs. So there's too many bugs in the system, right? Something is negatively affecting, if you start at the top, something's negatively affecting the hypothalamus in the brain, the pituitary gland, the thyroid gland, the adrenal glands, the ovaries, right? One of those areas from in the endocrine system is not working properly. And that is why maybe the ovaries, maybe it's mechanical, maybe the fallopian tube. So you have your ovary and then the fallopian tube goes down into the uterus. So perhaps there's a structural component to it, but something is not working properly on a female if they're having fertility issues, or male. So it takes two to tango, right? So it could be a female, I think I just locked up. There we go. So it could be a male issue, it could be a female issue, right? So if it's a female issue, we're going to check the whole entire endocrine system. We're going to check the pituitary gland, the thyroid gland, the hypothalamus, the ovaries, the uterus, make sure the adrenal glands, make sure all of those components are balanced and functioning optimally, okay? In a male situation, it may be that the swimmers are damaged or they're not producing enough. So we're going to check male endocrine system, which is also the hypothalamus, the pituitary gland, the thyroid gland, but the ovaries become testicles, so the testicles, right? And see what part of the equation is not balanced. So it's very interesting in a medical fertility clinic what they do to help try to improve fertility. It's not natural. They give the man extra testosterone, okay? So a guy who has too much testosterone or is taking synthetic testosterone, guess what happens to them? They get aggressive. They may get irritable. They may get mean, right? She was telling me about a case where the husband was on testosterone and he was being violent. Okay, so I'm not saying everybody who takes testosterone is violent. I'm just saying increased testosterone or imbalanced testosterone can cause aggression. It can cause anger. It can cause irritability. And so if your husband or your spouse is taking testosterone, that's not natural. If he's taking testosterone, his body is actually making less testosterone. and he can have other problems, right? And then for females, they're going to give them estrogen or progesterone or different types of hormones to try to help balance out the female. But they're not looking for why. They're not looking for the cause. They're not looking for a chemical toxicity. They're not looking for metal toxicity. They're not looking for bug overgrowth. They're not looking for the glands of the endocrine system that are dysfunctioning or unbalanced. They're not looking to naturally balance it. And it's the same whether we're talking about fertility, cardiovascular health, digestion, whatever the case may be. If there's a symptom, the medical paradigm is looking to suppress the symptom. If something is not working right, they're looking to bypass the system. If someone gets put on blood pressure medicine, guess how long they're going to be on blood pressure medicine in the medical model? In most cases, they're going to be in that blood pressure medication for the rest of their life. If I'm looking at a thyroid case and someone's on thyroid medication in the medical model, guess how long they're going to be on thyroid medication? For the rest of their life. Okay, so for fertility cases, so if you know someone who's looking to get pregnant, we're looking at the cause. Okay, and we had exciting news. So I want to tell you exciting news. We had 4 babies born last week. So exciting. 1 set of twins and 2 other babies. So adorable, so cute, and big wins. One of the mamas, it was her second birth. Her first birth was not, she was not a patient with us. This birth, she wasn't on bed rest at all. She didn't swell. She didn't feel bad. She was able to do what she needed to do with her family the whole entire time. This birth, she's producing milk, whereas the first birth, she did not. She's breastfeeding successfully, and her baby girl is beautiful. The set of twins that were born, 2 baby girls, beautiful babies. That mama did amazing. She did so amazing that her OBGYN was surprised at how well she was doing. She had no swelling. She was never on bed rest. If you looked at her from the back, you could barely tell that she was pregnant. She had this cute little twin baby bump, right? She wasn't like some moms with twins are huge. She just had this cute little twin baby bump. She delivered them naturally. She is a rock star. We supported her whole entire pregnancy, and now we're supporting her with breastfeeding, and she's just doing amazing. And then the last baby, I don't think the last baby has been in the office yet this week to see, but from what I understand, they are doing super, super well. When you balance out the systems of the body and you remove the causes naturally, the body can function optimally. So I want to say that again. When you find the cause of the problem and you balance out the cause naturally, the body can function optimally. Okay, cool. So let me say some hellos because I was on a roll right there. So let's see. Let's see if I can scroll in a good way. Hi, Greta. Hi, Michelle. Hi, Pam. Hi, Lizzie. Lizzie says, dang. Yeah, I agree, Lizzie. Yes, Pam, and an 8-year-old, that is crazy. Hi, Judy. Hi, Christina. Christina says, yep, I was on DIM. Several doctors wanted me to be on synthetic hormones. Thankfully, so Hyla, so it's one of our associate senior practitioners, is helping her. She said it was just a Band-Aid. Yeah, DIM is just a Band-Aid. We have to find the cause. So if something's happening in a female cycle, we need to find out why. It could be chemicals like chlorine and fluoride and bromide. So if you get baked goods, like your baked bread or your muffins or your croissants, that's from brominated flour, which can also imbalance your thyroid. It could be from heavy metal toxicity. So you could have mercury poisoning like I did. So I had mercury that was bothering my pituitary gland. I'm laughing because my dog keeps jumping in this live. And the mercury made me have irregular periods, right? So it's a toxic metal that I got from foods that I was eating and maybe my water supply. And maybe when I was a kid, it came from the vaccinations that I was given, but I was only given 7 compared to the 69 shots plus that kids get today. And so that heavy metal in my system was negatively affecting my master gland or my pituitary gland. It was making me gain 50 pounds. So if you're gaining weight and you don't know why, It could be that you have a heavy metal toxicity negatively affecting your endocrine system. It was making me have weird, crazy, irregular periods. It was causing me to be puffy. And then I was super afraid that I was going to not have the ability to have kids. And my kid popped in here. You want to say hi? She looks so adorable.
I'm eating chia seed yogurt.
So she's eating chia seed yogurt. Should we show them?
So
this is organic.
It looks like white dragon fruit.
It does look like dragon fruit. So it's organic yogurt. Sheep. Is it goat yogurt or sheep yogurt? And the black things in there are chia seeds. You like it?
Mia fed this to me when I used to go to her house. And I haven't had it in so long.
So she loves it. So she knows healthy snacks.
I just found it in the pantry. Ha!
Okay, thanks, Peanut. And so Leah is the result of getting the heavy metal mercury out of my system, rebalancing my pituitary, rebalancing my thyroid, cleaning out parasites, changing my food, changing my lifestyle. Because if you are a workaholic and you work 7 days a week and you work out hard and you are on the soccer field late at night and you are just pushing, it's too much of adrenal stress, right? So the holistic nutrition work that we do balanced out my pituitary gland, detoxed out the mercury. 50 pounds came off my frame, and 50 pounds on a 5'4" frame is not pretty. My periods normalized, my hair grew back in, and here I am. Here I am today. Okay, cool. All right, so Beth can't watch right now. I'll catch the recording. You're so welcome for the recording. Christina says, yay. Yeah, Pup Alert. Yeah, so they're both crashing my live. So hopefully Dr. Dean comes in and helps me, since I have two visitors that like to crash my lives. It's never a dull moment. Dwayne says, that's wonderful. My daughter lost 5 babies. Oh, no. Leah's hiding and Rio is not hiding. So due to doctor's misdiagnosis, oh my gosh, Dwayne, I'm sorry to hear that, and horrible treatment, and destroyed her left side and right side, at 10% chance of having another baby at 23. 8 years later, she had a miracle baby. Wow. So Kathy, I'm so happy to hear that miracle baby Melody is born. Can you take the crazy dog with you? Rio, treat. And yeah, so a lot of damage can be done when treatments that have negative side effects are offered, right? And so if you're looking at different treatments, you want to ask certain questions. And it's shocking to me how many patients don't ask questions, right? So one question would be, are there side effects? Every single medication has a side effect. Every single medication. Ibuprofen has side effects. Tylenol has side effects. Midol has side effects. So you want to ask, what are the side effects? If you want to find out yourself, go to drugs.com and you can look up the side effects. If you're going to have a procedure, what is the percentage of improvement? Or what is the percentage of success that I can expect? It is shocking to me how many people go through procedures and the doctors tell them, there may be no improvement or 5% improvement. To me, the risk of surgery for a very low percentage of improvement is not worth it. The risk of anesthesia, because remember, when you're going under general anesthesia, they're basically shutting your body down, knocking you unconscious to do the procedure. So what is the likelihood if I do this procedure that it will be successful, right? And then what are the long-term effects of this procedure? So some people, they'll have, say they have like a hernia surgery. That hernia material can fail. So there's a big class action lawsuit on people that had inguinal or groin hernia repairs, and the hernia repair materials are causing problems. And then what will happen in the future? So sometimes it's not disclosed very well. Well, if you have this surgery, you're going to grow scar tissue and you might need a repeated surgery. If you have this joint replacement, it's only going to last 7 to 10 years. So you might need to have another joint replacement. If you have this transplant, you might reject this organ. And oh, by the way, you're going to need to be on we'll just call it anti-organ rejection drugs for the rest of your life. So you really, 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 if you're considering a procedure, including us, right? If you're considering working with us, you want to know, how successful are we with cases like you? Are there side effects? Are there long-term effects? And what's the likelihood? What's my prognosis? Prognosis means how likely am I to get better? I will tell you, none of my staff, including myself, will take your case if we do not think we can help you. I like to sleep really well at night. I don't like to worry about patients. I love my patients. And so if one of my patients isn't doing well, I worry about them. I'm concerned about them, and so if I have a new patient and it's a case that I can't help, I will not take the case. And so some of you that have worked with me know that. Some of you that want to work with me, and I told you, I'm so sorry I can't help your case. It's not because I don't love you. It's because if we're going to work together, I want you to be successful. If you're going to work with my staff, I want you to be successful. What are the side effects? There's no side effects to whole food nutrition, right? I have a new staff member. She's a nurse, and she was a little nervous about certain things. And I said, you know what? I am Sicilian. And if I wanted to kill someone, this is kind of a joke, guys, so don't get upset. If I wanted to kill someone with nutrition, there is nothing I can give them that will kill a person. Like, I can't think of anything. Could I make you go to the bathroom a lot, poop-wise? Sure, we could do that. But there's nothing that I have on my shelves that would kill a person, right? I can make you uncomfortable and poop a lot, but that's about it. So even if my staff or myself made the biggest mistake ever, in most cases, you would just have more organic nutrients in your system. Okay, Lizzie says, pup alert. Yes, the pup was here, and he is so funny. Dwayne, let's see. Dwayne says, or Kathy says, she is so beautiful. Aw, thank you. She is beautiful. Brandy says, 44-year-old cycles every 2 to 3 months and night sweats like crazy. I've got to get relief. Well, Brandy, I would be happy to help you. We would be happy to help you at Palmer Natural Health. How do we help you? You call the office. You make an appointment. Right now, we have a March special. Usually, the new patient appointment is $250. Right now, it's only $120. And that includes your first visit with us. It also includes your report. It includes getting on the phone if you're out of Florida for a consult where we ask you your whole medical history. We ask you your family history. We ask you sometimes your dental history. We ask you if there's environmental components, like, did you work with paint? Are you a hairstylist? Did you have any kind of weird exposures? We talk about mold. We find out all the things that are not working properly, and we find out what are the treatments that you've done in the past. What worked? What didn't work? Then we take that data, we do what's called quantum nutrition testing. We are the only office in the world that does this technique. Now, at the end of March, I'm going to be training other practitioners, but right now we're the only office in the world that developed and delivers this technology. What does that mean? That means that we assess the data, we assess the information, and we test to see what is the potential cause of your problem. Is it from living in mold, which, by the way, would increase your estrogen and cause hormonal complaints like hot flashes, predisposition to cancers, heavy periods, cramping, that kind of thing? Is it due to a chemical? So I talked a little bit about fluoride and chlorine and radiation, bromide. Is it due to a heavy metal? So mine was due to a heavy metal mercury toxicity. Could be lead, which is in our environment. Could be arsenic. If you eat chicken, you can get arsenic from chicken. Is it due to a bug? So do you have parasites? Parasites is one of the number one overlooked things that physicians miss. So you have a parasitic problem. Is it due to some other reason? Then we look and we assess what will balance out those systems, right? So whatever's out of balance, how do we put it back in balance? Not by using drugs, but by using whole food nutrition or homeopathy or carbon technology. We use specific practitioner grade supplements, not stuff that you find in the grocery store. We figure out the exact plan that you need to improve. We find the exact doses that you need to take. And then we hold your hand and we coach you every single week until we get you better. And better to you might be no headaches. It might be more energy. It might be loss of 20 pounds. It might be gain of 20 pounds. It may be no cramping. It may be the end of your hot flashes. Could you believe if you didn't have hot flashes? Most women don't think that's possible. They think, you can get rid of my hot flashes? What are you talking about? I thought I had to suffer for the rest of my life. That is not true. And then we deliver that all on a second visit. So about another half-hour call or visit in the office where we put everything together in a report. We explain what we found, we explain the costs, and we say, yes, we can help you, or no, sorry, we can't help you. So Brandy, I would suggest doing that. All right, Heather, do you believe that you have to take hormones if you don't have a pituitary gland? All right, Heather, so it sounds like someone removed yours. And what's really interesting is that our bodies were created, developed, depending on your viewpoint, to be self-healing. It is shocking to me that someone could live without a gallbladder. It is shocking to me, someone like yourself could live without a pituitary gland. It is shocking to me that there's people missing thyroids, ovaries, testicles, missing pieces of lung, missing kidneys. I mean, it is a miracle what the human body can adapt from. Can someone who doesn't have a pituitary gland come off hormones? I need a little bit more data, right? I do not recommend, so if you're listening to this and I'm telling you medications are bad, I do not recommend if you are taking a thyroid medication, medications for a pituitary gland, medications for like a progesterone or estrogen or a testosterone or a psych drug. I absolutely do not recommend that you come off of those things cold turkey. I don't recommend you come off any medication cold turkey. You need to talk to your medical doctor. Why? Because if you are giving your body a hormone and then all of a sudden you stop giving your body that hormone, you can crash your system. Okay, so it's not good. So I would want to know, Brandy, I would want to know what happened to your pituitary gland. I would want to know, what medications you're on. Something happened there, right? And then I would find out I would want to know the cause, right? So did you have heavy metals in your pituitary gland like I did? Did you grow a pituitary tumor and they freaked out, so they cut it out? That's the case with a lot of people. I would want to find out why. How did you get your period back to normal? So I don't have cramps in my period. I don't have, I don't get emotional. I every now and then, if my stress is higher, which has been lately, I'll have a day where I can tell I'm like, my mood is a little bit more like, if you were to tell me a sad story, I might cry, right? But back in the day, I could be like that for days, right? So how did I get my period to regulate again and be every single month instead of skipping months? How did I not have symptoms with my period? I detoxed the heavy metal out of my pituitary gland. I stopped eating crap and I became a nutrition patient. At the time, my practitioner was 2 hours away. So every week I would drive 2 hours to see my practitioner for a 10-minute visit. And then I would drive back home, depending on traffic, it was either 2 hours or 4 hours. So I did that every single week for a long, long time until we trained local practitioners. And so that's what I did. So I found the cause of the problem, which for me was the initial problem was heavy metal toxicity. We detoxed that out using specific supplementation. And then I also had to change my food because I was eating some stuff that wasn't good. I was drinking some stuff that wasn't good. Does it mean that I eat perfect and organic and I grow all my vegetables and I grow all my fruit and I raise all my animals? No, I would love to have that. That would be beautiful. But no, I don't have that capability right now. Does it mean that I try to eat the best I can the majority of the time? Yes, that is true. Justina shared, thanks guys. So if you find this information helpful, if you know that there's someone who's really suffering with horrible periods, they want to get pregnant and they can't, they're sweating their shirts through, please share this video. All right, Michelle. Michelle says, oops. My best friend's BFF. Yeah, my best friend's brother about died from the hernia mesh. Yeah. So my father had a hernia repaired and he had a metal mesh, and the metal mesh is poking him. So he used to work out in the morning and do sit-ups and all that, and he had to stop doing some of his workout because the metal mesh was poking him and stabbing him. And now the body will grow scar tissue around it, kind of like a spider web. And so if you were to want to have that removed, it would be such a major surgery that most surgeons would not do it. Hi, Carol. Hi, Spike. Lizzie says, spoke with Aaron in your office today and ordered my products working with your hubs. Yay, Lizzie. That's awesome. P.S. Aaron is lovely and very helpful. I agree, Lizzie. She is awesome. She's an awesome addition to the team. Aaron, if you're watching, you're amazing. I appreciate you. Christina says, I'm so excited for a non-painful period. Yes, Christina. Once you have that, you'll be like, oh my gosh, why didn't I call them sooner? And then you'll send all your friends to us that are cranky and bloated and crampy. And it is amazing to me how many women suffer from really bad periods where they can't function. You know, I've had some employees in the past where they're like, yeah, I can't come in. I'm like, what do you mean you can't come in? They can't come in because their cramps are debilitating. They can't come in because they feel like they're, sorry to be graphic, they feel like their period's coming out like a faucet, right? You can't survive like that. You know, what if you have kids? You can't just stay in a dark room with a migraine and for days and days and days, although some people I know experience that and suffer with that. You don't have to have that. We can help you. Cam says, and you can take patients long distance too. Absolutely. So if you are in Colorado, Nebraska, California, Maine, Massachusetts, New Jersey, anywhere in the continental US, anywhere in the world, as long as we can ship to you. So if your country is locked down and we can't ship to you, so I'm sorry, if you're in Canada, I can't help you as far as sending you stuff. I might be able to help you, advise you, but Canada's tough. Right now, we can't ship to Canada. But anywhere else in the world, including Australia, we have patients in Australia, Denmark, Guam, Italy. So we are happy to help. Can you do anything natural with a quite visible hernia in a 2.5-year-old boy? I would want to know why the hernia is there. I would want to know what happened. So is it an umbilical hernia, meaning it's their belly button? Sometimes with umbilical hernias, kids grow out of that. Sometimes it's from another reason. So I want to test to figure out why. So we've had patients with belly buttons and umbilical hernias change. I've had patients with prolapsed bladders, and there's a surgery where they kind of tack the bladder back up and it falls back down. We've had patients where their bladder starts to stand back up again. You need appropriate minerals for your bladder to hold its integrity. You need appropriate minerals for your uterus to hold its integrity. You need appropriate minerals to have healthy teeth. You need appropriate minerals to have healthy joints. You need minerals for every single function in the body. And unfortunately, stress and sugar, including alcohol, pulls those minerals out of your body. Stacy says, I'm a patient in Washington State. That's right, Stacy. Let's see, above the belly button, born that way. Okay, so interesting, maybe not. I don't know. I would test to see what's happening there. Kim says, my daughter had an umbilical hernia from birth and it healed by age 5 to 6. Yeah, a lot of times with the umbilical hernias near the belly button, those repair on their own, which is really, really cool. All right, excellent. Well, guys, I wanted to come to you live on all this female stuff. So whether you have horrible periods, whether we didn't really get into it much because it's kind of gross, but whether you have discharge, itchy vagina, maybe the odors are not ideal, maybe you have hot flashes, maybe you're having fertility issues, whatever the symptom is, I would love the chance to help you. Please call the office. And right now there is a special for $120. We can help, or we can figure out if we can help. I would love for you to give us a chance and see if you can change. If you could not suffer with bad cramps, if you could live a day without sweating through your your pajamas. If you could have the baby that you've always wanted to have, I would love the chance to help you. If you want my help, simply call the office. It's at Palmer Natural Health. Until then, thank you guys so much for joining me. Thank you, Christina. Thank you, Heather. Thank you guys so much. I'm Dr. Lisa Palmer, coming to you live from Palmer Natural Health, changing lives, achieving dreams. Bye.